last one, and I promise this is the last one on the sun. Now, you've said all these effects of the sun, the ones that the negative, and we need to protect ourselves. But personally, I've seen patients who come to the clinics and they're always tired. Their energy levels are low. Some are even starting to think they're getting depressed. And then you do some investigation, you do their vitamin D levels, they're low. And you talk to them and, I'm always indoors. And we've always known that the sun helps with vitamin D processing. And if you don't do that, if you don't have enough of it, there are effects. So is there something to that?
There's something I didn't answer fully before I go to that. Sun protection, apart from sunscreen, there are other ways, like putting on a wide brim sun hat. Ataka unalima unavaa hiyo kofia. And then, maybe full sleeves. Like when you're talking of albinism, we make sure they have full, if it's a skirt, it's long skirt and so on. You remember they don't have the melanin. And now going back to that, and why Africans, we should not really say that there are no cancers because we have melanin. People living with albinism, and we don't say albinos anymore. We say people living with albinism. True. They have so many cancers. Okay. But again, it's because they don't have the melanin. So as we say that there are no cancers in Africa,
we have to consider them as
albinism is people, they are Africans actually. But that also shows you how much.
There are no white people living with albinism.
No, they're there. But now you see what is most obvious, of course, if you're black and you're living with albinism,
it's more obvious.
And then there's more stigma even, and so on and so forth. So those cancers are there, but it also tells you how important melanin is. So having said that, so protection, full sleeve and wide brim, because not everyone also can get sunscreen. Some are a bit expensive, and just avoiding the sun, that is one. But now you see, for these, the ones that we ask for full sun protection, or even when you go to those countries that don't really have much of the sun, most of their foods are kind of fortified
without vitamin D.
And some will even take pills. So when you come to the ones we really even advocate, because we have kids like with vitiligo, and we tell them, born with some, and we tell them you can't go to the sun. We have to take care of that. So we put them on vitamin D. Okay, but now those are the extremes. Now coming to us now, even with the PIH or hyperpigmentation and all that, we really don't do, even if you do sunscreen, but it's not like 100% sun protective, and so, there are other parts of your body that are exposed. It's not really 100 unless, as you said, mtu anakaa ndani ya nyumba full time without any sort of sun exposure. Definitely those ones will have an issue. Definitely. And if that's the way, maybe if you're bedridden and you can't go outside, then you need vitamin D. And that's why as doctors, as we take history, of course, we have to take care of everything. We need to really figure out, even if it's drugs we are giving, there are those who mess things with other vitamins, and we have to supplement for that. But it's hard for me who is applying sunscreen so that I go outside and then you say I can't get any I'll still get.
So vitamin D will not prevent you from processing.
Sunscreen really, it's not at 100%. If we reduce more of the intensity and the effect, but at the end of the day, they still, rays
still come
that you need, that will still get into your skin through even other areas.
Very good, very good. Are there side effects of sunscreen?
Now that would be, those are the heated topics. But what I'll say is this, there's like physical sunscreen and these other sort of chemical sunscreens. What I insist is, if you're doing sunscreen, pediatric age, please go for physical ones. They will just have the zircon. Hizi zinakuwa whitish, No, utapaka, but they're not being absorbed into the skin. They're physical. Some will leave like a white cast, and actually they're extremely protective. So these ones will just reflect the sun rays. And then there are these chemical. Now, if you tell me to use a pure physical, and the way I'm black, if I use a pure physical sunscreen, I have a white cast and it looks not so nice. You sort of have to do something else on top to hide it, of which sometimes you can do some makeup on top to hide, but you'll likely go for a chemical one because it's absorbed and it will not. Even now, I have sunscreen on my skin, and now these ones will absorb and make the rays less damaging and all that. So there are so many studies that are being done, and there are things that are, they say these, predisposes you more to getting that or that. But I'm telling you, even the blue band you eat
predisposes you to
that if you're to look at everything, I think you'll not feed, you'll not even use a lotion and so on and so forth. So, and most of these things are also studied, they are studied along even drugs at Panadol,
they're gonna side effects.
It's so
there are some.
We can't. A chemical is a chemical at the end of the day, but for that to really give you a side effect, I mean, of course, if it's a child, they absorb more. We don't want chemical sunscreens kwa mtoto, But for us, your skin has grown. The skin barrier is good. It's mature. The skin barrier is good. For you to really get to a point, because up to now, there's no cancer. Tunaweza sema hii ni juu ya sunscreens.
Sunscreen.
Ati hii umepata hii shida juu ya sunscreen.
There's no evidence.
It is, exactly.
Okay. All right. Good. That's enough. Sana hata inashangaa. Inasengenywa sana leo. All right. So in short, we need some sort of sun protection.
We need, because it will help
regardless
us
of how dark you are.
Yeah.
Regardless of how low you. All right.
It's good to do some level of sun protection.
Okay. Very good. Now let us switch gears. You mentioned acne in teenagers, and you said how much it affects their self-esteem. Is it purely a teenage issue? Because I've seen people in their 20s that is acne.
Not even 20s, 40s and above. So, but allow me to say something about the sun. I promise the last one.
I think you love the sun too much.
No, I mentioned about pigmentation, but now I wanted to say before we finish, another reason we want sun protection is the actual aging. And when I say actual aging, is the wrinkling. Is the wrinkles. So if you're doing anti-aging and you have wrinkles and all that, and you can't do sun protection, there's nothing you're doing.
What do you mean by anti-aging?
I mean, if you're doing anything to look better, to reduce your wrinkles, the dryness and all that. So sun protection is the biggest anti-aging. So I just realized, because you said pigmentation and all that, kuna mtu atasema, mi niko tu sa. So if you don't mind wrinkles and all that, it's okay. But if you feel like I really don't want that creasing you get, there's a certain thing you get,
makunyanzi,
maybe that's it. If you're doing sun protection, actually it helps to reverse that a bit and also slow the damage down. Now I've said that. Back to acne. So that's another reason we give Africans sunscreen to help with that.
Anti-aging.
So now as anti-aging and to protect from further damage of the skin and the elastosis, the wrinkling and all that. Now back to acne. No, if there's also acne in infantile acne, so it's all the way from infants. Mostly, they get hormones from the parents and all that, not the parents, the mother, and all that. So you can get that sort of acne at that stage. And then, of course, the majority is pubertal area. And trust me, in puberty, boys are even kind of affected more than girls. But of course, as we see, we likely going to see more girls, but the boys, trust me, even psychosocially, they are really messed up. And unaambiwa ni mwanaume and so on and so forth. It's so unfortunate. And they are
how you look doesn't matter. I'm an advocate of that.
Nope. They're really getting messed up upstairs because of, again, self-esteem, psychosocial and all that. So we need to be very careful with that. And there's nothing like telling someone it's adolescence. Fine, we know it's like a period, it's a hormones, it's a puberty, but that getting acne it's not normal fine, they will get, we know why they are getting, but it's not part of, how do I say, ati sasa we pata tu acne. No, it's supposed to be treated. That's
supposed to be treated.
It must be treated. Okay, because that pimple will not cause any, fine, you won't faint because of that pimple, you won't feel, though some are painful, by the way, but
some are painful,
then some can be even cause an abscess, ile na mwaga
I've
pus.
seen those.
Some are very tiny.
I thought those are the ones we treat.
Now we're supposed to treat everything, including the very tiny ones, because especially if they're leaving dark marks and scars. Unaona tu ni kamoja but inaacha kashimo. I'm sure you've seen even adults with those mashimo. Those are likely acne that was never managed when they were younger. And we manage acne to avoid the black marks and the scars mostly. Not because acne will kill you. But even now the actual acne, someone will even perform really badly in school because they have acne. This someone would have been a model, a hair hostess, some, music artist somewhere, but they recoil. I ended drama festivals because unajificha. You see how much it can damage someone's life.
But I think there's a point, I don't remember if this teaching was in high school or in med school. I'm not so sure. But we used to be told that just clean water, just wash your face, clean water and soap and relax.
We'll come to that.
And then wait it out.
No, now that is wrong. That's what we're saying. You can't say it's adolescence. You can wait, of course, it Aisha, but the damage during, as you said, psychologically, you're not going even with your friends, relationships as well, and then now, of course, now the damage after you come out of it.
Marks.
If you're among the unlucky ones, all those marks which actually affect maybe dating, marriage, career,
True.
and so on and so forth. And then now there is acne that actually comes in older age, like adult onset. Okay, there are people even after adolescence, it doesn't clear. It goes, and then now there is that starts in, adulthood. Okay, and there's that even, as hormones change the other way, from 35, 40, 45, and women are really mad. They're like, I didn't get acne when
as a teenager.
Why now? And it's tricky, but we get to figure out which pattern the acne is, and then we manage. There's no cure for acne.
It's a management.
We manage, and we get you through the period without, really being affected psychologically and less black marks and so on and so forth.
Is there a duration? Like if for example, in this case, a lady, they are maybe in a certain phase of their menstrual cycle and they have breakouts whenever they do that. They have like 6, 10, then they go away. And then again, the next cycle they get. Is that acne?
It's still acne, and it's, acne has how acne happens, is a number of things, and hormones also play a part. So usually during this period, the hormone bit of playing part in the acne comes, of course, into play, and that's why you'll see, the acne popping out, and then after that period, they just go down.
Are you saying that these people who get those breakouts during their cycles have acne, just that it's now coming up?
That is actually acne. And most will have, even 1, 2, most will have. So,
and that too is warrants management.
So it depends how bad it is, of course. And we tell you, for that who is getting only 1 or 2, likely they will not be on anything. But then we advise them not to pop that one, because even that one every month leaving a black mark and another, usually it will be like the same place. Of course, it will have some effect later. So there are those things you say, you don't, and these days there are even like patches that are there. It's like a kitu naekelea on that one for people. You can't put you like entire period you're applying and you're getting 1 or 2. But now when that one, there are patches that are there, and you can it's loaded with some medication for acne, and you actually just put there on that one, Yeah, and it just helps the cycle inaisha haraka without really leaving a mark, and it dries faster. But what we advise is that you don't pop, okay? Because when you pop, you cause more inflammation there, then the darkening, and then you can even cause a scar there.
So no popping.
Yeah, no popping.
You
Actually, that's one of the major causes of really bad pigmentation.
Isn't
popping
there
and
a nice way of popping it?
We do in the office, but usually we use a certain, if you really have to, not all acne is popped, but there are those, kuna zile tu sometimes we can help to remove, but we do it in a totally different way. So you just don't pop with
we
the
used
hand.
To say if you want to know your girlfriend loves you, she sees anything, she goes like on your face.
Yeah, so
like
that usually causes a lot of inflammation and maybe a dark mark. So if you can avoid, or even scrubbing, unaenda unafanya hizo facials. Remember, if you're more aggressive towards acne becomes more aggressive. So I tell people to cram that. If you're mild and unaipembeleza, hata hiyo inakubembeleza. Actually, it's so practical. So if you're scrubbing, you're doing all that thing, remember it's inflammation. You cause more inflammation. It gets worse, more damage. It gets worse, and the side effects are worse. If you calm, you calm it down, you calm down the inflammation, and then the outcome will always be better.
Nice. Speaking of scrubbing, are you talking about the facial scrub that they give us in the barber shops?
So kuna hiyo kitu rough they do, and even actual kuosha, with something tough, like gloves. You're not supposed to do that to acne. So I would rather use maybe a cleanser, with something like salicylic acid, in a very simple round movements. That's enough cleansing. But no.
So is that now? Are you talking about skincare routines?
Yeah, because now when you talk of skincare routine, it's not standard for everyone. If you have acne, your care is different. If you have pigmentation issues, your care is different.
Is that something like you teach someone about, depending on their skin, in your office?
Actually, yes. That's part of the main things, not main, but part of what we have to do. So whatever skin condition, okay, right now I think we're talking about the face. So whatever
the most important
condition whatever condition you have, then your routine is likely different from someone else. Two people could have acne, but still their routine is different, because your acne likely is just either abscesses, or your acne is just comedones. Your acne is a lot of pH, hyperpigmentation. So your routine will be a bit different from this other person. So it's really customized or personalized, because we treat that person seated there. If you have melasma, your routine might be a little different from the other. If you have a dry skin, if you have an oily skin,
I've had those, like, really.
It might not really be copy paste. You just can't copy paste. So the routine might be a bit different, but it's more of the ingredients.
So that thing of oily skin and dry skin, those are something like that?
Yeah, of course they are real. There are people who the moisturizing factors on the skin is not that vibrant, or doesn't produce enough moisturizing factors, and they practically get dry. Okay, so there are those who can get dry because they have a condition like atopic dermatitis or eczema, but now that's a totally different condition. But now generally, there are people who will have just a drier skin than another person. There are people whose sebaceous glands are huge and they produce a lot of sebum.
So they are oily.
They are oily. By 12, you can actually do this, and ni mafuta. So those will give maybe something that will be a bit drying, so that they're a bit comfortable. These are the person who want them to use heavy moisturizers because they have a dry skin. Also, what you wash with, whatever, if it's a cleanser, don't use a drying product that will dry the skin if you have a dry skin. So those simple things.
Now, speaking of skin types, I've heard that there is a machine. I don't know if this is a medical fact. That there is a machine people put their face in, And then it tells them what type of skin they have, something like that.
This is
That's a
becoming
thing?
a very big trouble to us. There are machines that analyze the skin. That is very true. So personally, I don't have that machine in my office because I don't need it. Of course, there are things that are being modified and to get more into it. But for the things we treat, personally, I wouldn't need a machine because there are those super obvious things.
You can just see.
And then there are, but now the machines I'm talking about, it's for those obvious things, those that are available. But there are other machines that can even tell you the wrinkling. They can stage the wrinkles on your face, and they're usually used in more of studies. If I'm producing like a serum that is anti-wrinkles, for example, I need to classify your wrinkles at the beginning and later. So those are different. We are not talking about those. So what we are talking about right now, so that you don't assume nimesema machines zote. Now those are different. The machines that people are demanding for right now are these simple ones you put your face and it analyzes. Yes, it will analyze. There's no harm with that. It will tell you like your face is wrinkled, it has pigmentation, you have acne.
But those are things you can see.
Yeah, so there's no harm, but I don't rely on that. You see, you might come umesema nataka utibu hii yenye machine imeona, and likely that's even not what you need. Because for me, it's at the end of the day, you go back to the science. You can't come and say treat pigmentation and now I know what is the cause. I need to figure out what is the cause of your pigmentation. Then I'll likely start treating that. But those, you have big poles, those are things I can tell. We even have let's say dermatoscope, that will even give us more information
than that machine.
Yeah.
So there is a machine. I thought that
there
was a
is.
room.
It's there. It's there. I've seen even in some pharmacies wameweka hapo. Most beauticians will have. So I'm just throwing, there's no harm. It's fine actually. Just have the printout, you'll come, we'll interpret for you, we'll assist you and all that. Na zenye hazina story mingi, of course, the beautician will tell you also use this, that. That's fine. But what I'm trying to deal with right now is when a patient even calls and insists they want to have skin analysis machine. And now me as a dermatologist, I'm trying to tell you I do clinical analysis of your skin, and there are those that are not satisfied because it has been sold to them. So
that reminds me of an issue as we face as yet to specialized doctors, that lab works. Oh my God. Patients will come, and if you don't send them to the lab, and I saw someone even saying that gynecology, how have they decided that I have PCOS without sending me to the lab? I'm like, really? How? You don't need those. You don't need
most
those
of the
things
time
if you have
you really
training.
don't need.
But it's a brainwash and it's a money-making thing, which is good anyway.
Yeah. So I work in Meru, and I get patients from Marsabit, even sometimes all the way from Moyale, and I'm telling you, I know it will sound like I live in 1980s, but there are now the ones I'm attending to, 2 men. Of course, we can't communicate because they don't speak any Swahili, but they'll come with their relatives. Usually, actually, they come the whole family. They really have your umoja. And of course, now I'll teach. One has atopic dermatitis, and it's chronic, and I'll teach and all that. And the first time the relatives told me, if you don't give him an injection, it doesn't matter what
you've said.
And of course, I refused. I was like, no, like you have to tell him do this. And they went, and he refused to use anything I gave. He practically refused, and he got worse. And they came back. Long story short, I had to inject normal saline, or was it water for injection? Like practically get the needle and inject. I couldn't believe I'm doing this in 2024, 2025. So it's so real. And now we had to have a deal. And the deal was, nikikudunga sindano, utatumia hizi dawa zingine. And I'm telling you, the guy was so happy. Na nilimdunga
sindano ni ya nini?
Yes. Sindano anajua tu hiyo ugonjwa
itapona. That is very old mentality.
So I know. So we dungad the sindano, and then he agreed to use these other products. And of course he improved. And the improvement was because of the
Daktari.
Yeah. So now as medics, we just have to figure out
we have
things.
To play around these things sometimes.
Because at the end of the day, you must treat that patient.
Yeah. I once did that and I felt so bad. There was a patient I had and they were having, so they were somatizing and they were having this pain that is not going away.
Yeah.
We've given everything. And the patient, morphine. I gave some my water for injection. They got better. That's
now
what this
those are things background information, but yeah, inabidi sometimes.
Interesting. Speaking of Moyale and those rural areas, when we're in the city, for example, the things you'll experience the most are acne, a rash. The other day I had a patient who have a rash. Yeah. I couldn't see it. Well, they insisted there's a rash there. But then I think when you're in the rural areas, you tend to see more like sicker patients.
So
what's the commonest
issues? So let me start with this.